Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, Anita Finley.
Very, very special guest again. You've heard Dr. Burton Feinerman, and he has a lot of new stuff to tell you. So, Dr. Feinerman, thank you for coming. I will tell you something for people who did come to the event when you spoke at the Marriott, along with Dr. Alsears. They're still talking about it. I don't know how... you felt that, I'm sure, that people, when you have someone come in and they start at 10 o'clock and you didn't end till 1 with a little bit of a break and they were mesmerized by you. I was so impressed the way that you managed that.
Yeah, well, thank you very much. I enjoyed it a lot. And
you have so much to say and you know so much.
Oh, thank you. Thank you. I have to get that homey little spirit that Dr. Mencia has. He's very special.
Fine. Everyone has their own personality.
Right.
But you do fine. But you really did connect them, those people sitting there. I mean, I've done a lot of events, and I watch, and usually about the first hour you can see people either falling asleep or kind of just glossy. They were not. They were very anxious to hear every word you said.
Yeah, and they stayed. Most of them stayed the whole time, yes. As I'm driving the car to come to the radio show here, and I'm half asleep, and I say, "Oh God, how am I going to stay awake?" So I say, "I got to listen to the radio, listen to some music or something." So I flipped on, and I hear a familiar voice. And sure enough, there you were talking about a rehabilitation center in great detail, and it was quite interesting. And then, of course, on comes Dr. Mencia, who certainly catches your attention in listening. So I managed to get here.
See, and you're wide awake now. You look good.
Wide awake. So it's been quite an interesting week because I have merged into the Sears Wellness Center, which is an incredible facility. It's on Southern Boulevard at 11905 Southern Boulevard, and there's about 50 employees in the facility. He does an amazing amount of marketing, which reaches out throughout the country, and he even has sort of where people contact him from all over the country as well as outside, asking him and actually conferring with something similar to Skype and getting counseling in that fashion. So it's quite unusual with a hyperbaric chamber and telomere testing and radiology, and so it's quite modern and unique. And he focused a lot on everything is holistic and natural at the facility, and also particularly bioidentical hormones that he works at there. So, and to me, it's sort of like a little fairyland to come into this place because it fits in so well into what I want to. One, first of all, the ability to reach out to this huge population that he does on a daily basis through his emails, through his books, his videos. And so it gives me an opportunity to see people who need my particular services, which are in the stem cells and gene therapy era. I've recently have had an opportunity to have contact with several agents of former NFL football players, people who have, unfortunately, because of repeated injuries to the head, have post-concussion type of syndrome, and some of them have been left in a pretty serious fashion. When the NFL came out with a summary of concussions in football, but it was revealed just yesterday in the New York Times that they were very selective in who they included in their group, and they were 10 or 20% of those who had received serious concussions were left out in the study. People like football quarterbacks like Steve Young and Troy Aikman were left out completely, as well as many others. And this was the NFL admitted this yesterday before some congressional panel. And so at the same time, I have been through a friend of mine, have been in contact with agents with the NFL, and we hope to have a meeting with them within the next week or two. And this place that I work at now is perfect for it because we have the opportunity of doing the stem cell treatments, which are the basic thing, and I can go into that a little bit more. But it also they have the telomere testing and giving telomerase to patients who have chronic injuries is very helpful. The tips and ends of your genes, which amount to thousands and thousands in your body, they're called telomeres. And just think of a shoestring, and the tip of the shoestring, that little plastic tip, that's the telomere. But as we age, that tip gets shorter and shorter, and until there's literally nothing left. By simply doing the telomere testing and placing yourself on an enzyme called telomerase, is probably the most modern technical way of slowing up the aging process. How simple that is. And anyone at the age of 65 and above should have telomere testing. But this is something we're also going to do with the NFL football players, where their telomeres have gotten shortened as a result of these concussions. And then we have a hyperbaric oxygen unit, which is so perfect to use in conjunction with the stem cells, the telomerase, for treatment of concussions. It was just yesterday, a man came into the office that I spoke to, and he spoke kind of rather clearly and well, and he had been a very esteemed and well recognized attorney, both here and in Detroit, and he also somehow or other got involved with a lot of local politics as well. Anyway, his favorite thing as an amateur was to play polo, and going back, I think it was 15 or more years, right here. And I'm sorry, it wasn't in Wellington. It was in Detroit that we was playing polo at the time. His horse suddenly had a cerebral aneurysm, the horse, and collapsed with blood coming out of his mouth and nose, as Donald Trump would say, from all of his orifices, and collapsed. And this man, who was the rider, in falling, collapsed underneath him, and the whole weight
killed him.
The whole weight of this horse upon him, and the gentleman had severe concussion, and many of the things are showing up now with his forgetfulness and his failure in short-term memory. And so he's quite concerned because he was always very proud of his memory, and now he feels concerned about the possibility of dementia occurring. And so, again, here's the opportunity for me to offer this man the kind of treatment. and we will give him the type of stem cells that will help to repair the damaged brain tissue. But also, and more excitingly, is that these stem cells will regenerate new healthy brain tissue. For years and years, there was this idea that if you injure your brain, tough, that's it. You have to somehow or other live with what you got left. And what we have learned in recent years is that the brain has what we call plasticity, and which allows a whole regeneration and repair process to go on. And so these are the things that we can offer. Injuries like this can lead to some form of Alzheimer's as well. And for years and years, patients have suffered with little decent therapy. If they start getting the signs of early Alzheimer's, they put on a drug called Aricept, which may give them some short-term help, but that's about it. And it's been the last 10 or 15 years, everyone's been focusing on the fact that when people have Alzheimer's, that they develop what's called beta amyloid plaques, which are protein plaques that clog up inside the brain and interfere with the transmission of from one nerve to another, the signals. And then as the Alzheimer's proceed, another type of agent occurs in the brain called tau protein. And this also causes like entanglements inside the brain, these protein entanglements that engulf the nerve tissue and again prevent the transmission from nerve to nerve through the axons. And so research has been going on to try to knock these agents out with monoclonal antibodies or with drugs that might dissolve these protein agents. And 15 years later, we have not accomplished one new thing. And yet, but what's exciting is that we've recently learned that the brain has a lymphatic system. Now, it's kind of amazing when you think, when we start to say, oh, how smart we are and how much we know and how much, yet here it is, 2016, and we first learn that the brain, like any organ in the body, has a lymphatic system which helps to get rid of the waste products from those organs that accumulate. And so now the direction can change abruptly in that we can make use of the lymphatic system. And the best time to do that is that a person should get at least 8 or more hours sleep each night, and that there will be agents that are already being developed that will help to clear the waste products just through this natural means.
Dr. Feinerman, I'm always so entranced with your speaking. I've let you speak a long time, but I have so many questions to ask you. I will tell you, because you've mentioned the sleeping process. My husband has lived a long time, and he always goes to bed at 10, always. And I've said, well, I'm not ready. And he said, well, you should get more sleep. And a lot of times I go to 12, 1, 2. Since I have met you, besides what Bill told me, since I've met you and you've talked about that, I work very hard now at 10 o'clock, 10:30 to go to bed.
Good.
And so I know that was good. The second thing is, though, I want to talk about what you would do. So I know someone who is a perfect candidate because he's quite a well-known personality here in Palm Beach County. And he has a touch now. He's just started to get Alzheimer's. He was telling me about that as we were talking on his 225-foot yacht in the Bahamas. And I want to recommend that he see you. Now, tell me how that would go. Explain, so if anyone else is listening, they have Alzheimer's, this man could definitely afford what has to happen and what he does. Tell me exactly what you would do and how it would work, would you?
Well, first of all, we would do a neurological examination in the office, which checks for normal and abnormal reflexes and sensation. We'd also want to watch his gait. We'd do a careful eye examination, especially to look at the retina. Getting down to the precise testing, we would do either a functional MRI or a PET scan of the brain. And unlike, say, the typical MRI, which shows anatomy, this shows physiology as well. And so that will give us some idea of where we stand with this gentleman in terms of does he have amyloid plaque and tau protein or misfolded proteins that have accumulated. Once that's done, we can probably go directly into considering a stem cell treatment for him. And he would get stem cells, which we can get from his own body, which differentiate into neuron stem cells when administered into the brain. And we also give some other agents. We'll sum it up. One is called brain-derived neurotrophic factor, nerve growth factor, neurotrophins, and glial cells. These are all essentially the supporting cells in the brain as well as nerve growth factors.
Excuse me, so how do you insert that?
The best way to do it is intrathecally, which is simply a lower spinal tap, which is done under local anesthesia. It should be done in a fashion that's totally painless to the person. And that's the ideal way. I've been looking into a simpler form and for the last 2 years. Haven't done it yet, but the more and more I read about it, it's sort of fascinating. And maybe as a repeat procedure, we have some nasal cannulas which can be inserted comfortably into the nostrils, and at the outer portion outside of the nose is a connection to a syringe, and we can put these same agents that I just spoke about, the stem cells and the nerve growth factors, that way. Now, the amazing thing is that the reports indicate that there are enough nerve endings in the nose that those cells penetrate the blood-brain barrier and are effective, according to researchers and in other parts of the world. So that's kind of interesting because of its simplicity of administration. That would be the big factor that we would do with him, but we'd also have him get in a hyperbaric chamber, and he would get a series of something maybe like 20 treatments
of oxygen, the 100% oxygen, which would also then maybe, as you said, the plasticity of the brain. It would maybe now help those new places to be oxygenated. Is that what you're saying?
Yeah, and also help to create new healthy blood vessels in the brain.
Yeah, this is very, very exciting stuff. And it was funny because while he was on my radio show the other day, he wrote a fantastic book, and anyway, had him on my radio show. He forgot something. It was just a simple thing. He said, that's my Alzheimer's. And he has been tested at Mount Sinai in New York. I mean, he really has had everything done. But I get the feeling, and I don't know what else is happening with him, but I'm very close to suggesting that he talked to you. And so I'm so glad that you're here this morning so that I can do it. But before I forget, I just want everyone to know you're listening to Dr. Burton Feinerman, Feinerman. And I'm going to give you a phone number to call. It's 561-784-7852. So that's 561-784-7852 to set up an appointment. Meet Dr. Feinerman. He will be now working with Dr. Al Sears at the Wellness and Anti-Aging office up there on Southern Boulevard in Royal Palm Beach. But Dr. Feinerman will also be speaking at the Cure Symposium on April the 9th. It's really exciting stuff, and I've always loved this. I've been doing this for almost 30 years now, and I always look for the latest and the greatest. I hate the word to say that together. But stem cells, definitely, it is the way to go. But you have to be very careful to whom you meet with and make sure that they are really credentialed, that they can show you results. And Dr. Feinerman does have that. He has patients that would be very proud to tell you how much it's helped them. Look, nothing is going to ever be perfect. As we're aging, there are things, but why not get the best, like your telomeres? I love the discussion on that from Dr. Sears, and that there's something that you can help to not only remain at your premium, at your best as you age. We're all going to eventually die, but I think you said it, or someone said it, that isn't it nice to live to 110 or 120 all of a sudden, and you don't wake up the next morning, but you're living in good health, rather than live so long and then have everything wrong with you. Right. So you have great philosophy, Dr. Feinerman, and I'm so happy that you're a part of this. And I was very impressed with Dr. Sears, and that he was brought to the event that Dr. Feinerman had because he thinks a lot of what he's doing. He's not doing the same thing as Dr. Feinerman. It's just the holistic approach, isn't it?
Yes, well, Dr. Sears is probably the father of the anti-aging medicine era. And I like to think of myself as the pioneer of the stem cell era. So it's a good combination that a patient gets both of us.
Yeah, it is, and I think that, as I was saying, people were mesmerized by your event at the Marriott. People haven't heard much about this. You know, you read about all this, but then to have the living person right there talking to you and with all your experience, and I just think it's an amazing thing that you yourself, of course, you're no spring chicken, as none of us are, but you look fantastic and you live a very busy life, and you're loving every minute of it. But did you think 50 years ago, whenever you first got your medical degree, let's just say, you started off as a pediatrician and did that for many years, that you would ever be at this position? What did you foresee for yourself?
Oh, it's kind of hard to imagine. When I decided to become a doctor when I was about 8 years old, because my sister had Down syndrome, and I felt very frustrated as a young child. Why can't you make my sister better? You know, and I saw all the efforts that my parents took to care for her, so that she could have as normal a life as could be, and so that was something that remained in my thoughts for many years. So I was very fortunate when I was a little bit older, as old as 12 years of age, that I met a boy my same age. His name is Hans Mark. And Hans Mark, his father was very famous as the pioneer in polymer and plastic chemistry, and world-renowned. And they had escaped from Nazi Germany through very difficult means of getting out of Germany to Austria, to England and Canada, and finally, of all places, the capital of the world, Brooklyn, New York. and Hans and I became close friends. At that point, I was interested in being the shortstop for the Brooklyn Dodgers, and he kind of interfered with that portion of my career. And Hans, he was tough to keep up with, because as he emerged in adult life, he became the director of the NASA space program after Wernher von Braun for many years, head of the space program. He was the developer of the space machine that's up there all the time. And he later became Secretary of the Air Force under President Carter and Clinton. And he subsequently was chancellor of the University of Texas in Austin for over 10 years, chancellor. So he was a tough guy to keep up with.
And is he still living?
Oh, yeah.
And so you're still friends?
He's 2 weeks older than I.
So he's still friends, and so does he love what you're doing with stem cells?
Well, I can't understand a word of what he's doing, and he can't quite follow what I do. So it's funny, but
it'd be great to have him come down sometime. So
my God,
wouldn't we have? That'd be a wonderful thing. We'll have to work on that.
Oh wow!
Okay, we'll have to work on that issue. Maybe our next Cure Symposium, we'll get him in as the keynote speaker or something.
He would
we'll work on that.
I could do that.
Okay, well maybe we're going to do that. It's getting better and better. Ever since I've met you, it's just been thrilling. And I know that we're going to try to put Dr. Mencia together with Dr. Sears and you and, form a real nice triumvirate or something that's very special. You are a special human being. I've told you that. And you're bringing something to South Florida that we haven't had. And I appreciate that so much from you.
Well, I'm lucky I have a beautiful, wonderful wife, too.
Oh, you do? Oh, yes. Tamika is just gorgeous, and she's smart, and we have to bring her around to some of our stuff. We'll have to get her on the radio sometime, too. We'll bring her here with you. I know you just want to get up this early. That would be
fun, yeah.
Well, we have about a minute left. Doctor, let me just give your phone number again. Any of you suffering for some very, very serious diseases, please do read Boomer Times. You'll see Dr. Feinerman. You'll see all the things that he can work on for you. This is the new time, everyone. Don't sit in your chair and mumble. Just get on the stick and get some help from Dr. Burton Feinerman. Call 561-784-7852. 784-7852. You can also go to his website, stemcellgeneticmed.com. But thank you, Dr. Feinerman. It's always wonderful having you on our show.
Okay, and you keep going to sleep at 10 o'clock at night.
Yeah, I'm going to. Thank you. I'll know that's my new Feinerman technique. Thank you.